Good morning, everybody. My name is John Corlett. I'm the president of the Center for Community Solutions, and I want to welcome you to today's webinar. We've got two really fabulous guests with us this morning, really experts on the Supplemental Nutrition Assistance Program and its effect on real people, on families and older adults and children here in Greater Cleveland. First, I want to introduce Rachel Cahill. She's a visiting fellow for public benefits at Community Solutions and also a nationally recognized expert on the nation's #1 anti-hunger program, the Supplemental Nutrition Assistance Program, or SNAP. She's worked with Community Solutions to develop a benefits access partnership, and that coordinates local and statewide advocacy and policy reform. Her previous professional experiences include roles with the Benefits Data Trust, Drexel University's Center for Hunger-Free Communities, and the Greater Philadelphia Coalition Against Hunger. She also consults with state agencies and national organizations, and we're so glad she lives in Cleveland now. And also, Katie Gideon is a benefits outreach manager at the Greater Cleveland Food Bank. She's a community advocate, an anti-hunger and older adult enthusiast, and she provides a direct service perspective on the SNAP program and its impact on the local food banks and the communities they serve. So I want to encourage people, if you've got questions as we go along on the program, just enter them in the chat. I'll be paying attention to that, and I'll turn it over to Rachel. Thank you.
Thank you so much, John, and thanks for encouraging us to do this webinar. We knew this was an important topic, and there's been a lot of media attention and a lot of questions in the community. So glad we could make time and that Community Solutions would host this for us today. And welcome everybody. I see some familiar faces and friends and a lot of new faces, names popping up as participants. So thank you for joining. I'm going to be our tour guide today. Happy Valentine's Day. I'm wearing red for the occasion. Here is what we're going to cover today between Katie and myself. So we're going to start with the basics and talking about what were our SNAP emergency allotments, what is this extra benefit, and talking about the most imminent thing. So if you're just here to find out what's changing, we're going to do that up top so that you get that information right away. Then we're going to spend a little bit time going a layer deeper into SNAP to talk about how SNAP benefits are determined and the deductions that really make a huge difference for your benefit allotment. So we're going to spend some time there. We're going to talk a little bit about access barriers at county JFS offices that can sometimes make it difficult to get through or to get credit for those deductions. So we're going to do a little bit of tips and best practices there. And Katie is an absolute expert when it comes to navigating JFS. And then she's going to share a little bit more about the application assistance network that is available through the food banks and through their partners all throughout Ohio. And then we're going to go into some policy recommendations because hunger is not inevitable, right? We do have choices. We always have choices, and we can always make decisions at the state and federal, but we'll talk about state specifically level that could reduce the impact of this hunger cliff that we're facing with the end of SNAP emergency allotments. So I'm going to try to ignore the chat because I get distracted by it. John's going to watch that for me, and I know the Community Solutions team is also watching the Q&A. So please feel free to comment and ask questions throughout the presentation, and we'll make enough time for a discussion with those at the end. All right, you ready, Katie? Let's get to it. All right, so thank you, John, for introducing us. This is us. Our emails are here. You'll have access to this deck as well as the recording. I know that's always a question that we get. So this is available, and you're welcome to reach out to any of us at any time afterwards. So let's start with the overview of SNAP emergency allotments. The emergency allotments are one of the most effective things that Congress did when the pandemic started to immediately get resources into the hands of families who they knew needed them, were quickly losing jobs, and would spend them quickly at the grocery store. We know from the Great Recession and from previous downturns that SNAP is one of the best sort of economic stimulus efforts that the federal government can make. And so thankfully, a bipartisan group in Congress and President Trump, all signed on to this relief right away. And it immediately started helping families. So for the first year of emergency allotments, which were, this extra SNAP benefit that was a second deposit on a SNAP account at the end of the month. So families went from getting one deposit a month to getting 2 deposits a month. So for the first year, what emergency allotments did is they brought all families up to the maximum benefit for their household size. So for the first year, it was only helping those who were already getting a benefit below the maximum value. And then in the beginning of the Biden administration, so in May of 2021, there was also an additional benefit for those already at the maximum. So since May of 2021, every SNAP household has been benefiting from SNAP emergency allotments, getting essentially $95 or more in an extra benefit. So as you can see, the value has been huge. It's ranged from $75 million a month all the way up to $126 million a month that Ohio has been receiving. And I added that all up, and it turns out it was about $8.5 billion that we have received in fully federal funds to help pay for groceries in Ohio. So it's hard to overstate how important this program has been. Here's a little chart if you're more visual. This is the red is what regular allotments looked like over this span, and the blue is that bump that we got from emergency allotments. It represents about 30% of the total SNAP benefits that were coming into our state each of those months. So again, really significant. And you can see in March of 2023, so next month, that benefit is going to drop, and you can see what that's going to do to the total SNAP dollars available in our state. All right, so what's changing? As I've alluded to, this month, February 2023, is the last month that families are going to get emergency allotments. So the normal load date, for any SNAP recipients who are joining us, they often know that it's called a load date or a deposit date. Typically, the base benefit that you receive, your load date is between the 1st and the 20th of the month. So based on your case number, your last name, there's, maybe I always get my deposit on the 12th. So my base benefit is whatever got deposited on my EBT card on the 12th. With emergency allotments, I was getting that second deposit, usually the 27th or the 28th of the month. But February is the last month we're going to get that second deposit. So families will get it this month. They can expect to get it this month, but in March, there won't be that second deposit. And ODJFS, the Ohio Department of Job and Family Services, has already been notifying families about this. So if you are a human service provider, you have probably already gotten a lot of these questions from folks who got these letters. They're mailing notices, they're doing robocalls, they're doing texts for folks who have opted into the text option. And there have been a lot of social media posts, and I expect that those will continue over the next month to make sure that this message reaches everyone. And I just have an example here of the letter that went out to families. So if you would like a copy of the full letter, we have that. We can share it with you. Also, we can share any of the guidance documents that the Ohio Department of Job and Family Services has put out. If you want to share social media posts, Ohio Advocates for Ohio's Future has put out a toolkit for community assisters and for other advocacy organizations and human service organizations to help spread the message, because this really is kind of a team effort to make sure that no one is blindsided and no one is surprised that these benefits are ending. All right, so we're going to talk about the impact. This is the part John's talked about this on IdeaStream. There's been some media stories. I know our administrator of JFS, Kevin Gowan, has done some media stories around this, which has been really helpful to hear. But we want to talk about the impact in 3 ways. We're going to talk about the impact for SNAP recipients. We'll talk about it for grocers and the retail sector. And then we're going to talk about the impact on food banks. Okay, so let's start with the impact on SNAP recipients first and foremost. So all 738,000 SNAP households will experience a benefit cut in March. So there is not a SNAP household that won't be impacted by this. The average reduction per household is $172 a month based on the best data that we have available. Some will be less than that. The minimum reduction folks will see is $95 per household, and that's for families who are already at the maximum benefit allotment for their household size. And then if you're interested in the sort of per person, it's about $86 per person, because of course people live in households and SNAP benefits are issued in households. So that's why we typically talk about it as a household cut of $172 a month. But at the per person level, it's $86 a month. To put that in perspective, there was a SNAP benefit cliff at the end of the economic recovery relief in the Obama era of 2009, 2010, that era when we had some extra SNAP benefits. We saw at the time that was about a $23 per month cut that people faced, and it was dramatic. I mean, people felt it, food banks felt it, the economy, you know, there were economic signs you could tell that that money had come out of the economy, and this is proportionally much bigger of a cut that families are facing. It was proportionally bigger of a investment that the federal government made, so that's part of the explanation, but we are going to feel this in a big way. As you might have seen in some of the other conversations around this, the biggest cuts or reductions in benefits are really going to be for households with children. They tend to be bigger households to begin with, and therefore they're likely to see the biggest reduction. And so that average is about $223 a month of a reduction for households with seniors, because they tend to have relatively higher income due to Social Security and other retirement income. And so they tend to get, their base benefit tends to be smaller, which means that their emergency allotment was bigger. So their average reduction is going to be $168 a month. And for individuals with disabilities, it's $190 a month. So those are the folks who are going to feel this the most. And of course, it's coming at a terrible time because food inflation is so high. It's the highest we've seen in 40 plus years. And families are kind of saying, of all the times to take away this extra support, this is a really difficult time to do that. So I'm going to pause there for a second and just see, I see there's some chat going on and maybe some Q&A. So John, anything in the chat or questions that I should respond to?
I don't think yet, Rachel. I think mostly it's people just we're offering some of the resources that you're referencing and letting people know what we'll be sending out. They're going to send out a recording of the session to everyone who signed up for it, as well as any of the materials that are referenced.
Awesome. Great. Thank you.
Sure.
All right. So let's just, again, for those who are visual, here's a quick snapshot that was part of a paper that we put out a couple weeks ago on this, that's linked here, that you can read after the fact. But you'll see that because SNAP benefits are so dependent on your household makeup, the size of your household, and the other available income to the family, it's hard to say, we can't say to folks, everybody's going to see the same level of a cut. We really want to communicate to folks that what your SNAP budget looks like, and that's why we're going to talk about deductions. That's really going to be the telltale decision maker on whether you see a really large drop here. Like, this example of a working parent with 2 children could hypothetically see a really big cut or not, depending on how much their deductions are and what income is on their case. So that's what we want to go through in some detail. All right, let's talk about the grocery retailers. Maybe some of them are joining us. I know some of them partner with your organizations or your food banks. They're going to feel this too in a big way, right? So we're talking about $126 million a month of a reduction in SNAP spending. In Cuyahoga County alone, it's about 23 million of a reduction that they're bracing for, and that's a 43% cut in SNAP spending that local grocers are going to face. So we think about our grocers in distressed areas and farmers markets that serve distressed areas. This is going to make their viability really challenging in some cases. And so I think it's important to be partnering with our grocers, talking with our grocers, so that they're preparing for this, they're stocking for changes in spending patterns, because we know that the same thing happened on the other side when this benefit came into play, right? There was a lot of demand for grocery stores. They couldn't keep their stocks, their shelves stocked. Now they're going to have to adjust to a different reality of the amount of spending families are able to do with their SNAP benefits. And the economy, again, it's hard to overstate how big of an impact this is. If you take that $123 million a month and add the economic multiplier that SNAP provides, because it is a stimulus to our economy, it's almost a $2 billion reduction in economic activity over a year that Ohio will have to absorb. So a very big deal, and we want our Ohio policymakers at the state level to be paying attention to this. All right, so let's talk about food banks next. Katie, do you want to take this on?
Yes. Hi, everyone. Again, I'm Katie Gideon from the Greater Cleveland Food Bank. So when we talk about the impact that this is going to have on food banks, we can't stress enough how important SNAP is to the work that we do. For every one meal that a food bank can provide, SNAP provides 9 meals. So we can never make up for the gap that this would leave with the SNAP program. Food banks across Ohio are anticipating that the end of SNAP emergency allotments will lead to increased need, increased visits to our partners, and those are the individuals and organizations that supply the emergency food to our communities. To give us a visual, as I know Rachel talks about visuals a lot, we can look at this, this graph right here. The Greater Cleveland Food Bank has been tracking our muni lot distributions since the pandemic. And we noticed trends that when an assistance program lapses or ends, the dramatic strike that we see in individuals that are visiting our food programs. So you can see over here the expiration of the extra unemployment benefits that we had in the beginning of the pandemic, and then the gradual increase that we see at our muni lot distribution. You can see how it goes down in visits when the Ohio tax credit payments begin, and then how it slowly creeps back up as that expired. And then we're also seeing the dramatic increase as inflation has started to drive more people to our programs. And so inevitably, we believe that on the end of the SNAP emergency allotments will increase the visits to our partner agencies and for our programming. Next slide. And we don't know what's going to happen, but we do have some insight from food banks across the country where this has happened already. So in Florida, where their emergency SNAP allotments ended in August of 2021, they felt it immediately. This is a quote from Second Harvest Food Bank of Central Florida after the end. It's a daily disaster. The month after the SNAP emergency allotments ended, food insecurity among SNAP recipients there jumped from 19.4% to 47.9%. So we're really bracing for such a dramatic increase in food insecurity and just trying to be prepared to be able to serve people at the best of our ability. Next slide. And we can't talk about this without talking about the fact that Rachel alluded to, we're having the largest amount of inflation when it comes to food since 1979. You can see in this graph here, all grocery food has an increase of 12.2% between June 2021 and June 2022. And you can see the different categories of food and the increase in cost. And then also looking at the USDA Thrifty Food Plan, the difference between December 2021 and December of 2022, the weekly cost of food and the monthly cost of food. And just to give some context, this is the Thrifty Food Plan. So this is the most bare minimum of food that a family can survive on. And the increase over $100 a month for a family is dramatic. Next slide. So now we're going to move into SNAP Basics. So we talked about the impact.
Katie, this is John Corlett. I wonder, and maybe Rachel too, you know, we talk about food insecurity a lot. What does that mean? What does it mean when we say people are food insecure? What does that mean they can't do or can do?
Yeah, so food insecurity means that individuals don't know where their next meal is going to come from. And there are questions that individuals ask at different nonprofits or healthcare systems that can identify if someone is food insecure. And in our Cuyahoga County service area at the Greater Cleveland Food Bank, 1 in 7 individuals is food insecure.
Yeah, thanks for that question, John. And we have, thankfully, USDA has a really well-validated tool so that we can kind of consistently measure food insecurity over time. And so, you know, lack of access to enough food for an active and healthy life is the sort of broad definition that we use. And in the individual question we ask is, yeah, do you know where your next meal is coming from? Do you worry about running out of food this month? You know, have you run out of food? Those are the specific questions that community providers and even healthcare providers often ask to kind of get this really validated understanding of what food insecurity is that folks are experiencing. So I think it is striking what Katie referenced about Florida, that folks, SNAP recipients immediately had this anxiety, right? This fear that comes with not knowing where your next meal is coming from. It jumped from 20% to almost 50% the month that they lost emergency allotments. And that anxiety, we know that has all sorts of health ramifications. It affects people's ability to get to work, to perform in school. So it has really a wide-ranging impact in our community when folks are going through that stress and that anxiety. But we are the Center for Community Solutions. So we are going to talk the rest of this. We started with the doom and gloom, and we're going to spend most of the rest of the presentation really focusing on solutions. So at the individual level, what folks can do to minimize the benefit loss for their own case. And then again, what our policymakers at the state level could do to reduce the impact of this thing that's happening, right? That happened at the federal level that none of us can stop. So Katie's going to do a little bit of SNAP basics, and then she'll turn it to me and we'll go through some deductions.
So talking about SNAP basics, we're going to talk a lot about data in this presentation, but it's really important for us to realize and remember that we're talking about people. We're talking about Ohioans. We're talking about our community members, our neighbors, our friends, our family, and that's really easy to forget when we get so deep into the data. So the vast majority of SNAP recipients are people. They're elderly, they're disabled, they're children. Adults enrolled in SNAP are low-wage workers, and SNAP has a work requirement. And even during the pandemic, they had the work requirement. So without SNAP and Medicaid to help manage chronic conditions, many working-aged Ohioans would be unable to remain in the workforce. That's important to center our conversation around the people that this will impact. Next slide. So who is on SNAP? 1.5 million Ohioans receive SNAP. And as I talked about earlier, here's the breakdown. 42% of people who are on SNAP are children, 17% seniors, 32% disabled individuals, 28% single parents, and 12% are non-disabled adults without children. SNAP benefits are 100% federally funded. For those who don't know, the SNAP income limit for most households is 130% of the federal poverty level. And as I said earlier, the vast majority of SNAP recipients can and do work, but they work in low-wage jobs. And so this graph here actually shows that the statewide SNAP participation has really remained steady throughout the pandemic. And many individuals who rely on this program are in the labor force and do work. Next slide. I'll turn it over to Rachel.
Thanks, Katie. Yes, it's really for folks who also work on Medicaid. I think this is sometimes folks are surprised to know that SNAP kind of operated normally throughout the whole pandemic. People's benefits cases closed, incomes continued to change, and their cases continue to be updated. So it is quite different from there are other presentations you'll hear about what's changing in Medicaid and how that caseload has gone up during the pandemic. But SNAP has actually stayed steady, and it's actually starting to go down. Some of that is constraints on our local offices being able to process cases. So we'll come back to that in a little bit. But let's talk about deductions. I realize it doesn't seem like a really exciting, sexy Valentine's Day topic, but it is so important in the SNAP math of how you understand how SNAP benefits are calculated. So the two pictures on the side here are those income standards that I'm going to talk over. Katie just mentioned that SNAP's income limit for most households, this is for households that don't have an elderly or disabled member, is 130% of the federal poverty line. You can see that here listed out as a monthly amount. So for AG size stands for, the AG is the assistance group. That's JFS slogan, jargon. But so a household of 3, for example, has to earn less than $2,495 in a month to meet the initial gross income test for SNAP. And if you're $1 over that, and you're not in an elderly or disabled household, you automatically can't get SNAP. So it has a very low and strict gross income test. But after passing the gross income test, the agency looks at the net income. So there's actually 2 income tests that you go through for SNAP eligibility. So the net income standard is actually the poverty line. It's 100% of the poverty level. So using that same example of the household of 3, their net income has to be below $1,920 to qualify for SNAP. So then, of course, the next question is, well, how do you figure out what my net income is? That seems complicated, and it kind of is, because things that count as deductions for SNAP they're not a perfect parallel to what's a deduction on your taxes, for example. So there are specific deductions that count for SNAP and ways that we count it that we're going to talk through. But then fundamentally, you figure out your net income, And then the way you figure out your SNAP benefit is you subtract 30% of your net income from the maximum benefit. So I'm not going to make you do that math, but just if you're wondering, how does the agency come up with this number? It seems so arbitrary. That's the fundamental formula that we're looking at. So we'll give you some examples of how this works. But just a few more points to make on how the calculation works. So thankfully, at least SNAP does take into account certain essential living expenses as well as work-related expenses. So because SNAP likes to promote work, there are several ways that the SNAP benefit calculation promotes earned income. But the burden of proving a deduction generally falls on the SNAP household. We'll talk a little bit more about this later. But if the agency doesn't know about your expense, like your rent, then you're not going to get credit for it. That's what it comes down to. So it's important to communicate whatever living expenses and work-related expenses you have to make sure that you're getting credit for it in that SNAP calculation. And during the pandemic, this didn't happen as much as it regularly would have, because there wasn't as much of a consequence, essentially. If I didn't give my proof of my rent to my JFS office, well, my base benefit was going to be lower, but I was going to make up for it with a higher emergency allotment at the end of the month. So we saw the number of families kind of consistently sending in their verification. We saw that kind of go down because it was less relevant to the ultimate amount of money that they got. So now is the time, right, for households to submit proof of their deductions of their expenses to JFS, so they make sure that that base benefit amount is correct. And that's really was the impetus for this training, to make sure families knew how to do that and what was deductible. All right, so let's do an example to get out of the nerd math for a second, and just look how it would impact a family. So this is the Johnson family. They're a household of 4. Their gross earned income, meaning the amount of money they get before taxes are taken out, is $2,800 a month. They pay $900 a month for rent, and they separately pay their utilities. So let's say they have a heating bill and they pay for their water. They also pay $500 a month in childcare costs. So during the pandemic, with emergency allotments, they were getting $939 a month as their total allotment, right? So that's a good amount of money to help with groceries. If you look at going back to Katie's slide on the thrifty food plan, that's about what the thrifty food plan says a household of 3 needs for a month of groceries. So it doesn't even get what a family of 4 would need at this point, but still a good benefit. Without these deductions taken into account, their benefit will drop all the way down to $325 a month, because that's what their base benefit would be without getting credit for their rent, their utilities, and their childcare. But if the Johnson family turns in those documents, let's say they turn in a rent receipt, they turn in a gas bill, and they submit proof of their childcare expense, they're going to see their base benefit go up to $662 a month. So it doesn't make up for that all the way back to the emergency allotment, but it makes a really big difference on what they're going to receive going forward. So hopefully that example helps. I can come up with lots of other examples if you want to throw some at me and say, what would, after this presentation, I'm happy to do any kind of technical assistance to help kind of figure out. And these are, of course, approximates. Whenever I work with a family and give them an estimate, it's always ultimately up to the Job and Family Services office to make the decision on the benefit amount. But you can give an approximation based on how we know the SNAP math works. All right, oops, I went one too far. So for the lawyers who are in the room or in the crowd, I do have citations here to some of the federal rule as well as to the Ohio Administrative Code, so that if you are unsure of where I'm getting this information, it's cited for you. These are all of the types of deductions that we can do in SNAP. We're not going to go through every one of them because I would need an extra 2 hours for that, but we're going to focus on the most important deductions and the ones that families should be thinking about proving if they haven't recently submitted this information to their JFS office. So those are the ones that are bolded here. It's the earned income deduction we want to talk about, the dependent care expenses, shelter expenses, and medical expenses. So if you walk away with nothing else, remember that these are the key categories of deductions that families get when in the SNAP calculation. So quickly, let's start with the earned income deduction. anyone who is working is getting this automatically. So this is the one where just by nature of proving your income, which you already have to do to get approved for SNAP, you should get the 20% income deduction. This is one of the many ways that SNAP builds in a work incentive into the SNAP math. The other one I wanted to make sure to highlight, though, is the standard self-employment deduction. So we know that during the pandemic, lots of folks have picked up different types of work, have done more freelance work, have driven for Uber, Instacart. There's lots of different ways that folks have come up with income. I know a lot of folks who have started their own cleaning businesses during the pandemic. So Ohio has elected a simplified way of accounting for the fact that as a business owner, you have various expenses for running your business. And so instead of you have to kind of kept every receipt and proving every tank of gas that you filled up for Uber, there is this standard simplified deduction. So because families, this is something that the worker should automatically get you, but if you are an assister who's helping with the SNAP math and helping someone make sure they're getting their best benefit amount, this would be something to make sure that they're getting if they are self-employed, because it's a less commonly used deduction. Sometimes the caseworker working the case might not be aware of it. So just wanted to highlight that. All right, dependent care deduction. This is a really big one, and it is one of the few deductions in SNAP that does not have a cap. So before a previous farm bill, there used to be a cap on how much a family could deduct for childcare. And it was wildly unrealistic because childcare is wildly expensive. And anyone who has kids knows that. So thankfully, Congress decided a handful of years ago, I think it was the 2014 Farm Bill, it might have even been before that, they got rid of the cap on dependent care. So if you spend $1,000 a month on dependent care, you get $1,000 deduction, as long as you have the receipts to prove it. And so the full cost of childcare, as well as dependent care for an incapacitated adult, that is the term that is in the code, but it's really an adult, who needs a caregiver, who needs to go to an adult daycare program, or who needs another type of day support, that also counts as an expense for SNAP. You can also include the cost of transportation to and from care. This is a piece of the deduction that's often left out or forgotten. So if you have to drive, 30 miles to get to your childcare facility, you can count the mileage that you spend in your car as a deduction. Or if you have to have a bus pass, that can be part of your deduction if you need it in order to get to childcare. And you can include expenses paid to even a family member, as long as they're not part of. So like if you take them to your mom's house and you pay your mom, you contribute to what she is getting to pay for the childcare that she's providing, as long as she's not part of your SNAP household, that is a countable expense. So if you look at national data, only about, don't quote me on this, I think it's about 40% of households with children are getting a dependent care deduction. So it's underutilized from where it probably should be for the age of children that folks have and are enrolled in SNAP. Katie, anything you would add on the dependent care deduction based on your experience at the food bank?
No, I don't have anything to add, but later we'll go on to how assisters can help you make sure you get that deduction.
Awesome, thanks. All right, the next biggie is shelter costs. Shelter costs means your rent, your mortgage payment, homeowner's insurance, property taxes. It also includes utilities. So if you pay for heat or cooling, telephone, water, sewer, those are all utilities that are taken into account. The thing about the shelter costs is that it isn't a straight deduction the same way that the child care deduction is. It is only a deduction if it is over for 50% of your household's income that you're spending on shelter. So if I'm only spending 25% of my income on my rent, I'm not actually going to get a deduction for that because it's an excess shelter cost. So it's meant to really only be a deduction for those with a higher shelter burden. Like if those of you who are in the housing sector, there's sort of a thought around a cost burden of housing. And when it's over a certain percent, it's considered a cost burden. It's a similar concept that's built into SNAP. So this one is a little trickier to figure out, but the reality is that most people who are eligible for SNAP have a very high housing cost burden, right? Because if you're only making $2,000 a month and your rent is $1,000, right, that's 50% of your income right there. So most people do qualify for a shelter cost, but the math isn't as obvious as it is for the childcare deduction. Right now, not only does it have to be over 50% of your household's income for it to count, it also does have a cap. So the maximum shelter deduction you can get is $624. That's set at the federal level, so that's not something Ohio can influence. And many families do hit that cap. And so so there are folks who are very rent burdened who unfortunately don't get as big of a credit for it as we hope that they will. And we hope that a future farm bill will change this the same way that the child care deduction was changed. One other piece on this, and I'm sure this is one of Katie's hot tips, so sorry if I'm stealing it from you, Katie. On utility costs, if you pay for all these different bills, you don't actually need to submit every one of them. The heating and cooling cost is the most important one because that's the one that triggers what's called the standard utility allowance. I didn't create a slide for that because it's too nerdy, but just know that if you pay for, like if I just pay for gas, or even if I pay for all 5 of these, the gas bill is really all I need to submit, and that will trigger the highest deduction. All right, and you can see the OIC code is here if you want to look up more about the shelter cost. All right, the last big one that I want to cover is medical expenses. So this deduction is reserved for households who have an individual who is over 60 or older, so considered elderly by the SNAP definition, or disabled. So if you are not elderly or disabled and you have medical expenses out of pocket, you cannot get a deduction for them in SNAP, unfortunately. It's only reserved for this population. And so you need to have an out-of-pocket healthcare expense that's $35 a month or more. If it's less than that, they don't count it because they basically decided that it's not worth the effort of the county and you to verify it because it wouldn't have a big enough impact on your SNAP benefit. So, but that being said, there are a lot of costs that count here that are underutilized. I think only like 14% of older adults are getting a medical expense deduction, which is far lower than it should be. So healthcare premiums, a Medicare premium, Part B premium, that would count. Any kind of cost sharing, co-payments or anything like that would count. Any prescriptions, any over-the-cost medications or supplies. So, if you have somebody who needs, an over-the-counter asthma drug or an over-the-counter allergy drug, or Depends is a supply that, a lot of older adults are buying. Anything over, and a lot of the declassification of drugs has caused a lot of things to no longer be prescriptions and just an expensive over-the-counter item. Those can all count as deductions for SNAP. That same thing with dental care, hearing aids, glasses, as well as the cost of transportation. So, again, if you pay for a car to take you to your doctor's appointments and that is not reimbursed by Medicaid, for example, then that was something that would count as a SNAP deduction. So unfortunately, the only way to claim these medical deductions is by verifying each one of them. So it can be labor intensive for both the household and for the county. One of the things that we've been recommending for years at Community Solutions is a standard medical deduction. I think I wrote a paper about this in 2017, maybe. So we'll talk about that at the end as things Ohio can do to simplify things. But some states do a simplified deduction more similar to the way that the shelter costs work in order to minimize the burden of proving all of these, gathering all these receipts to prove. All right, I know that was a lot on deductions, but hopefully you didn't show up today if you didn't want to talk deductions. Go ahead, John.
Yeah, a couple of questions. One person wants to know how the calculation works, particularly around utility bills for households that are participating in the percentage of income plan. That's the utility assistance plan.
Yes, so great question. If you are separately billed for utilities, it does not matter what if it's included in your rent, like your landlord pays the bill, you can't get credit for it in SNAP. But if you are responsible for the bill, it doesn't matter whether you're paying $50 a month or $700 a month. You're going to get the same standard utility allowance, is what it's called. The SUA is the acronym that the state uses. So an individual who's on a payment plan with the utility company would qualify for the deduction.
And then we had a couple of questions about persons with disabilities. I think we've addressed the first question. As you started, you were sort of focusing a lot on the employment-related deductions around childcare and things like that. And they wondered about deductions for persons with disabilities. And we talked about that with excess shelter costs, and now this medical expense deduction. But one person asked, can individuals with disabilities who receive SSI qualify for this medical expense deduction?
Yes, 100%. Yes. Anything that is out of pocket, like I said, transportation, over the counter, if Medicaid pays for it, or you have, if it's paid for directly by your insurer, it's not a deduction. But if you are responsible to pay for it out of your SSI benefit, for example, that would definitely count. And one thing I failed to mention on the shelter costs, I'm going to go back and add this asterisk, is there is not a shelter cap. There's not a shelter cap for households with disabilities and
Right.
households with seniors. So
Right.
they can go up to however their housing costs are.
And I think we're going to get into this next question a little bit as we get into this. But the question was, is there a tip for the best way to submit, the proof of these deductions? Is it, are you mailing them in, or do you have to take them in, send in copies of each receipt? So maybe we'll get to that. So why don't and the other thing I just want to tell people, we will be sending a recording out at the end of this session. There'll also be a place, we'll send you the link about where it'll be posted, and any references or materials that we referenced during the presentation, we'll be sharing it well. But why don't I let you guys keep on going then?
Okay, great. Yes, great questions. And we are going to get into proving deductions on the next slide. I see that there was one more question in the chat that I can take now, that is around if it's in the landlord's name or someone else's name. So this you can still get credit for it if you have separate proof. So for example, you could have the landlord or the other person who's named on the bill write just a letter meaning just write down, this person, Katie Gideon pays me $200 a month for this bill, or Katie Gideon pays this bill even though it's in my name. So this is often something that happens when, like, maybe the homeowner is, the homeowner doesn't live there, but they've never switched over, like a grandchild lives in the household and they've never switched over the name of the utility. So that can count. You just need to have a document trail for it. All right, let's go to the next slide, and I'm going to let Katie help me with this one, because this is where her expertise for the Help Center and the application assisters comes in big. All right, Katie, do you want to take this?
So Rachel talked about the deductions, and then we're going to move in, well, how do you prove these deductions? So verifications are so important for households who have higher shelter costs, as Rachel said, families with childcare costs, and then of course the senior and disabled households who have medical deductions, because we have such a low rate of older adults that put in verifications for their medical expenses. As you know, Ohio requires SNAP households to submit proof of deductions. So if a document is unavailable, so we had a few questions in the chat about that, such as the landlord who maybe has the bill in their name but the tenant pays. So what type of paperwork or verifications can you turn in? Collateral contacts or self-attestation. So simply writing, having the landlord or write a letter that states that you pay that bill. But also counties do have a duty to assist households in proving their eligible expenses. So if someone is talking to their JFS caseworker and states that they need help, for an example, if they need help to get a verification that states that they used to be employed at an organization, JFS has the duty to assist to reach out to that organization to get that verification document for the client. And there's a lot of different ways that someone can turn in proof of deductions. They can upload them through the Ohio Benefits Self-Service Portal, which we'll talk a little bit more about later. They can email them, and I'll drop in some emails that I have from the 3 largest metro counties across the state of Ohio. They can drop them off or mail copies to their local JFS offices, and then also they can fax, but those numbers vary based off county. So there's multiple different ways that you can turn in these verifications. Next slide. And there are assisters across the state of Ohio that can help you do this work. We know that it is a burden to turn in these verifications and that there's lots of barriers that exist for individuals such as older adults or those who are disabled who maybe can't turn in these verifications on their own. So application assisters across Ohio can help educate you on which deductions you may be able to claim. So Rachel just went through all the different deductions, and those can get really confusing for people, but assisters are knowledgeable and educated on which deductions individuals may be able to claim and turn in verifications for. Most importantly, assisters can assist you. They can help you submit those verification documents. They can help you gather them. They can help you write some of them. They can turn them in to the Ohio Benefits Self-Service Portal. They can email them to Job and Family Services, and they can make sure that those documents are received. And lastly, they can advocate for you. We know that sometimes things aren't received or things get lost in the shuffle, and they can advocate and contact JFS or even make legal aid referrals if it's appropriate, if there is something that you think wasn't deemed right in your case. Katrina Queen just had a question that I will go into next is, how do you find an assister near you? We will talk about this later on in the presentation. Next slide. Oh yeah.
Yeah, thanks, Katie. So yeah, we're gonna talk, we have links and phone numbers for all of the assisters around Ohio. That is a slide I'm gonna get to in a few minutes, so we'll go over that. I wanted to, we like to keep it real and acknowledge, like, as Katie said, sometimes the systems that are set up don't work as well as we expect them to or want them to. And so there are a lot of, I wanted to kind of give a baseline of what's going on with some of our JFS offices and some of the barriers that they're dealing with, and then talk through some tips and workarounds to help folks navigate. But John, before I do that, were there any other questions that we should address?
Yeah, a couple. One's kind of a very specific question. The person was wondering, how are things that somebody might use over the course of the year, like a pair of glasses or dentures, they have that expense in 1 month, they pay for it. Is that expense just counted towards that 1 month, or is it spread out over a year for something like that?
That's a fantastic question. The answer is either. So you actually can choose if you want it counted in the month that you spent it. So you can take it all as one lump payment, or you can average it out over the year. So either one can work.
Okay, and another person asked this, they work with households who get SSD and they're disabled, and they're told that they're not eligible for that higher sort of I guess disregard or whatever that you referenced earlier. And I just wondered, is that correct? Or, might that be an area where maybe more education might be needed?
Yeah, it can be so the individuals with disabilities technically do not have a gross income limit. So they don't get kicked out at that 130% level, which means though that you could be at 210% of the poverty level. And then your net income would need to come all the way down to 100% of poverty to qualify. And so what often happens for those households is they don't have a gross income limit, but they don't get below that 100% threshold with their expenses. You'd need to have really high shelter costs and pretty high medical costs to qualify at that point. So I'd say for any individual examples, I'd be happy to kind of run the SNAP math for them and let them know if maybe an error was made, and Katie and her team can do that too. But that often does happen with households with disabilities who get SSD, which is a little bit higher level.
Great, thanks, Rachel.
Yeah. All right, so let's spend a few minutes talking about access barriers. And I know that we may have some JFS folks with us, and so I welcome them to add additional detail in the chat if they'd like to. But I wanted to just kind of give an overview. So first, I want to say, it's important to acknowledge that our JFS workers at all of our 88 counties, including here in Cuyahoga County, have been very dedicated to serving customers throughout the pandemic. They quickly had to figure out how to go remote, how to work from home, how to answer phone calls, how to process applications when the rest of the world, was shutting down in the beginning of the pandemic. And quite frankly, if you know any of them or love any of them, they are tired and they are burnt out, right? Many of them have really struggled to keep up with the high demand for their services throughout the pandemic. So if you know a JFS caseworker, be kind and give them a hug and say Happy Valentine's Day. But it has impacted service levels, right? Because that burnout has caused a lot of folks to leave the role. You add the tight labor market that we've been in, and there are very high vacancy rates almost uniformly across Ohio. We hear that from JFS directors. It's certainly true in Cuyahoga County, Franklin County, but it's also in some of the smaller counties. I heard one rural director say, if you show up for the interview, you're hired. Like, that's all it takes, because they're so desperate for workers. So the other thing that's really impacting service levels is because of that vacancy rate, some counties have still not reopened all of their offices. Here in Cuyahoga County, for example, we just have one office that's still open right now to the public. There were 4 open before the pandemic began, and now we're down to 1, which is the Virgil E. Brown building downtown. And again, it's a staffing constraint that it's hard to staff those offices when you have so few staff to answer the phones and to process the work. So as any of you who've called JFS probably know, there are very long wait times to get through. And in some cases, application processing has also been delayed. So we want to help folks understand, only call when you really need to call, and try, if we can help folks find their information other ways, then we want to encourage them to do that, so they're not stuck in these really long queues. And we have some tips for that. So just a couple of visuals for you. This is a statewide data that I collect. This shows the call wait time over from the beginning of the pandemic, or before it began in December of 2019, all the way through this past December. This blue line shows the average time people waited for their phone call to be answered. You can see that has been going up basically since April of 2022. And the red line is how long people wait until they give up. So that's the average time to abandon. So people are waiting, on average across the state over 50 minutes before they finally say, I can't wait any longer. So things are really tough. There are features like virtual hold that sometimes work, where you can kind of keep your place in line and have them call you back. But it's often, you don't know when that call back is going to come. Sometimes it's, could be the next day. So it's a tough situation with calling. And again, this varies by county, so it's not a universal experience, because each county has a different call center that they're operating. And then this just shows you the volume. So it's part staffing and it's part volume. You can see the red line shows the answer rate. That is the percentage of calls that actually got answered compared to the volume of calls, which is the blue bars that came in. So again, you can see it's kind of taken a nosedive since April of 2022. And we know that our counties are, they're running overtime. They're trying a lot of different staffing models. Cuyahoga County just spent a couple weeks kind of shortening their call center hours to try to catch up on some of the back end work that was generating these higher call volumes. So there's a lot going on that our counties are dealing with that's impacting these high wait times. And again, I told you I wasn't going to be too depressing later on in this presentation, but this is worth noting. This little graph here shows over the past December of 2021 to 2022, the types of calls that came in statewide. You can see almost half of them were customer service, meaning they weren't designated as a type. But only 7% of them at that time had to do with Medicaid. And as you probably know, Medicaid redeterminations are just now starting up, and folks are going to start losing Medicaid from the continuous coverage provision in April. And so if call wait times are this constrained now, just imagine when you have 3 million people on Medicaid being processed that are going to have questions and concerns. So I often say, counties have a math problem, not an effort problem. So let's, this is one of our recommendations to state policymakers, we need to think about how do we reinforce the counties and their capacity so that they can handle this workload. All right, another tool that is here for us, but has still some work to do on it, is the Ohio Benefits Self-Service Portal. You heard Katie reference this. If you've ever tried to use it, it's been around for a while, but hasn't always been the most user-friendly tool. We have, Katie and I and a number of you around the state as application assisters have worked closely with the Ohio Department of Job and Family Services over the last year or two to really identify areas where the self-service portal could improve to make it easier to use and to work out some of the glitches. So there have been some recent updates. It is now mobile friendly. You can upload verification photos from your phone. So those are two priority features that we advocated for and that the changes the state made. But because a lot of Ohioans haven't had a lot of trust in the system, there isn't a lot of folks using it. I think the last data I saw was that about 12% of JFS customers have ever used the self-service portal. So there's a big learning curve to using it. And that's something human service organizations can help folks get comfortable using. You have to set up an account with an email address. You have to kind of be a little bit tech savvy to be able to use it. That said, it is still a tool that can be used to help get these proofs into your county. You can also do other things like interim reports can be done there, recertifications can be done there. So once you do get comfortable in it, it's a good tool to be able to know how to use. Katie, anything you are the premier expert on the self-service portal. Is there anything you would add? I know we're trying to keep it high level. We didn't do screenshots or anything here, but any other advice you'd want to give on that?
My only other advice would be if you're interested in utilizing the self-service portal to turn in your verifications, to complete an application. Again, we'll have more slides to reach out to the community sister near you because they are trained on the system. They work in it regularly and they can assist you in learning the features and making sure that everything is done properly.
Great. And Katie, why don't I keep it with you with this last round of tips?
Yeah. So Rachel talked about obviously the high call volume. And so that's one of the big things when it comes to the end of the SNAP emergency allotments, turning in verifications, making sure you get the largest deductions you can. We want to make sure that we're avoiding calls to JFS if it's general questions. If you have general questions, again, we have assisters across the state that are knowledgeable to answer those questions for you and can point you in the right direction. We don't want you waiting on hold for hours to get a simple question answered. Use the Ohio Benefits Self-Service Portal if possible. If you already have an account, you can go in there and do lots of the document uploading and change reporting for your deductions. And you can also reach out to an assister to help you with that process. There's nothing that you take away from this webinar. I hope you take away, submit your proof of deductions. You don't want your SNAP benefit to decrease so dramatically at the end of this month. If you turn in your deductions, you can hopefully get a high enough benefit that you won't feel that as heavily. I'll hit this home again, utilize the Ohio's Application Assistance Network. The next slide will tell you all the assisters across the state and how you can find one that can help you in the county that you live in. And also utilizing other services where you can check your EBT balance. You can call the EBT line so you can check what your balance is. Again, instead of calling Job and Family Services and waiting on hold for many hours. One important thing is that your benefits do roll over from month to month. So if you have accumulated a large amount of benefits from the SNAP emergency allotments, you can stretch those out over months. You don't have to spend it all at the end of this month because the emergency allotments are going away. And then lastly, reset your EBT PIN to avoid threat of skimming. There has been some stolen benefits that have happened throughout the state. And so it's just important also for security purposes to make sure that your benefits stay with you. Next slide. So how do you locate an application assister near you? I have put on here the 5 food banks across the state of Ohio, all of their phone lines that you can reach out to apply for SNAP or get assistance with any of these things. And they cover a multitude of counties. So if you go to this website here where it says need to find an assister near you, you can actually see all the counties that they support across the state of Ohio and make sure that you're finding the right food bank that can assist you, not only with SNAP, turning in verifications, but also if you need to locate food in your area because of the end of the SNAP emergency allotments. And also this is a statewide program, and also the Ohio Benefits Portal is a statewide portal. So you can call any food bank to get assistance. You can call the Greater Cleveland Food Bank, no matter where you live, and we can assist you and make sure that you're connected to the local Job and Family Services that's in your county. And I'll turn it back over to Rachel.
Thanks, Katie. Well, we have one last slide, which is on policy recommendations. But before we do that, John, were there any other technical questions that we should address?
I think I mean, the question was, recipients get a letter, with a time and date that they're supposed to call in, then they're on hold, they can't get through to their caseworker. You don't get any response. Are those folks at risk of losing their benefits?
Yes, this is unfortunately a really common scenario because a couple of years ago, most of the counties went to, or at least Cuyahoga County and some others, went to this sort of call-in model instead of a call-out model. And so it used to be that you maybe waited by the phone for your caseworker to call at 9 a.m., but now they say, call in during this window. And all that does is it puts you in a queue for the interview line. So it's still a good idea to call during your window because they are staffing, counting on calls at that time. But if you're not able to get through at that time, you can call another time to try to get through. And if you repeatedly are struggling to get through, that's where we really encourage, engage an assister, engage with legal aid, because if you don't get that interview done that's required, you will get denied, and you will then you'll have to go through the reinstatement process. So if you are in that situation where you've already been denied, appeal and say, I tried on these days to get through, I never could, and that's why I was denied.
Great.
Katie,
Thank
anything you would add on that?
No, you said that perfectly. Engage an assister, and most importantly, engage with legal aid in that process if you feel that you were wrongfully denied or you tried to call in multiple times.
Great, thanks. All right, I know some of you are here for the policy recommendations and are less in the client management role. So let's spend the last bit of time we have together here, because as I said at the beginning, we do have choices. Hunger is not inevitable. And it does take political will though, right? To be able to do something about the hunger that we're facing. So we have 4 recommendations for you. I'm going to go through them one at a time so I don't overwhelm you with a busy slide. The first thing that is a no-brainer is to raise the SNAP minimum benefit from right now it's $23. That's a federal minimum. We could raise it in Ohio to $50 a month. We could raise it to $80 a month. We could raise it to $95 a month, but $50 a month is a recommendation that's being made by Advocates for Ohio's Future and others. And we have seen some other states have done this with a state funded benefit. And this is a really good time to do it, of course, because this is the moment when especially seniors and individuals with disabilities who are most likely to be at that minimum benefit level are going to face this big drop in benefits. So now would be a really smart time to do it. And it wouldn't really be that expensive of an investment for the state, because we're talking about, essentially a $27 a month benefit for the elderly households who are not already, only about a quarter. The last data that we had pre-pandemic was that about 25% of households with older adults were at the minimum benefit. So this isn't an overly ambitious ask. I think it's a really reasonable policy for our state to consider in the budget process that we're going through right now. And it's also to think about the investment that this would be for saving us on healthcare costs. We have really good research now that shows that for every $10 increase in SNAP benefits for dual eligibles, and so older adults who are eligible for Medicaid and Medicare, which tend to be the most expensive in the healthcare system, we see a reduction in nursing home visits and hospital admittance. So it's really a preventative strategy that would save on healthcare costs in the long run by increasing the floor of the SNAP minimum benefit. So that's recommendation number 1. Love to anyone else who wants to collaborate that on or work on that together. I know there's a lot of interest from from the Ohio Association of Food Banks and other groups that I believe will be advocating for that. All right, the next very obvious one is streamlining verification requirements for SNAP. So as we just talked about, it's a pretty complex process to prove your deductions, and the most complex is for medical expenses, as we just talked about. So a really reasonable thing to do that has been done, I think, in 21 other states. Yep, there it is on my slide. Is to create a standard medical deduction. This is essentially a no-cost thing that our state could do to simplify how workers are counting medical expenses. And the way it works in other states is the eligible individuals, they only have to prove the first $35 of their expense, and then they get a standard amount. So in Massachusetts, for example, it's $190 is the standard medical deduction that they get. as long as they can prove that first $35. So it's a win-win for cost savings as well as for the beneficiaries, and it's something I think Ohio should consider. And it would be a really nice build on something our legislature did last budget, which was to implement the Elderly Simplified Application Project, or ESAP. That was a first step towards simplifying the program for older adults, and this would kind of be the next step to do after that. Improve technology is my third recommendation. As we just talked about with the self-service portal, this has been a long area of interest for all of us in this space of it, seeing that self-service portal improve. We have talked with the Department of Job and Family Services about this, and we know that they agree that we need a better customer interface. It needs to be really built with a human-centered design premise so that it's much easier for folks to kind of intuitively navigate, especially for reporting changes and uploading documents and creating accounts, which are really the core basic functions that we want it to have. And that would really save a lot of work for the counties as well. If folks could do more self-service things, then it would be a lot fewer calls to our counties, and they could focus on the work that only they can do. We also know that more back-end integration needs to happen with the portal that our caseworkers see, because there's a lot of manual work that we know happens when a document is uploaded in the self-service portal. Somebody has to kind of intentionally pull it over into the worker portal. Applications have to be pulled over into the worker portal. So I think some of the technology improvements could be made to really simplify this for our workers, where they could put their time where it's better spent. All right, and my last recommendation is to set our county JFS offices up for success. As I talked about, you saw my slides on the call center times and how much they're struggling with staff right now. We really, it's so important that we provide adequate resources to them so that they can retrain and retain their staff, because without that staff, none of this works, right? All of our customers suffer, our economy suffers. People take time off of work to try to figure out their benefits. It causes a vicious cycle, and we really need to invest in those JFS offices. And we also need to not add any new burdensome requirements. We know that proposals have been considered over the years that would make it even more burdensome on our counties to run these programs, and we need to not make the mistake of doing those sorts of things right now with so much on our counties. So I'm going to stop there, and I think we still have a few minutes for questions. So thank you all for staying with us this long. I'm impressed that this crowd has been this interested in SNAP and deductions. So thank you for being here. John, what other questions or comments do we have?
I think we've handled all the questions that have come in so far. We've still have 100 people here participating in this webinar, so that's really great. So I think we've wrapped everything up. As we've said a few times, we'll make the recording available. We'll make the extra materials available, so everybody will have the resources you need to sort of address some of these issues. So thanks to Rachel and Katie for an excellent program.
Yeah, thank you. And I do see one question that I don't know if I addressed it, so I'm going to just say it again, just to be clear. Thanks, John. It was about how long SNAP benefits stay on before they expire. So Katie made the good point that benefits roll over month to month. As long as your card stays active, like as long as you're using your card, your benefits are going to continue to roll over, and your sort of, it's called the expungement clock. That's the nerd term for it. It's when your benefits expunge, which means they go off of your card and you can't get them back. That happens after 9 months of inactivity. So sometimes you'll hear benefits will stay on your card for 9 months. That is true, but it will continue to roll over as long as your card stays active. So it actually can be longer than that. So I hope that helps answer that question.
That's great. Thanks, Rachel.
And one other question that I might have addressed is around the self-service portal. I think someone asked whether it's for individuals or assisters. And the answer is it's designed for individuals. It's designed with the idea that I, Rachel, am using it for myself. But because application assisters play such a big role, there have been some workarounds and some modifications to the system to allow assisters to help as well. So Katie, I don't know, you do this your team does this all day. Is there anything you'd add on that if someone's trying to navigate the self-service portal for the first time?
Just say, I think I've said this a few times, so apologies. If you're navigating it for the first time and you have questions, please reach out to the assister in your area. It is made as a self-service portal for a single individual, but we can guide you through it. And we do this every single day, all day. So no one needs to try to do this on their own and not be able to complete an application. We want everyone to be able to get the benefits that they deserve. So again, if you have questions, my email will be in this presentation. If you assist individuals with SNAP and you have questions, or if it's for yourself, please reach out and send an email to me.
Great. Thank you again, Katie. Thank you, Rachel. Great presentation. And thanks to everybody who joined us today.
Bye, everyone. Thank you.
Bye-bye.
Bye.